Keeping life as normal as possible for your child during treatment is so important. In this video, we'll discuss the ways to encourage this. This video is for children receiving treatment under haematology and oncology teams. For those children that have received a bone marrow transplant, advice will be slightly different. Please seek advice from your bone marrow transplant CNS. This video aims to give you the guidance for you to feel more confident with aspects of everyday life on treatment. We encourage normal social interactions with friends and family as much as possible, unless they're known to be infectious or visibly unwell. Going out, we also encourage this, although where possible, avoid large gatherings if your child is neutropenic. Whilst we know that public transport can often create anxiety, we advise that children on treatment are safe to travel on public transport. However, if you wish to discuss this further, please contact your key worker. Your key worker will advise you when your child can return to school. We advocate for children to return to school on treatment. Your child can attend school even if neutropenic when they're well enough to do so, and we encourage this. School liaison will occur prior to starting or returning to school to provide information and support. Your child should be encouraged to be active throughout treatment, although there may be individual restrictions depending on your child's condition. If you have any worries or questions about this, please discuss this with your local teams or key worker. If you're considering booking a holiday whilst your child is on treatment, this should be discussed with your lead consultant. One very important consideration when choosing a holiday destination is knowing where the local hospital is if your child was to become unwell. This should be close to where you are staying so they can get prompt medical attention if needed. We recommend you take your family held record and most recent clinic letter with you, just in case. Whilst your child undergoes diagnosis and commences treatment, there's a variety of support available to you and your family. You may not meet all of these team members at the start of treatment, but they attend meetings with the medical team and will become involved if needed. We recognise the psychological impact a cancer diagnosis can have on the whole family. Many families find referral to the psychology team very helpful, but we understand many people may require this input at different times. Some families may not want to access this service at all. If at any point you feel this could be helpful to you or your immediate family, please let your key worker know. Appointments with the psychology team can be arranged in many different ways, such as on the ward or visiting daycare, or even separate appointments can be made. Parents can meet separately or together, depending on the support you feel is beneficial. If at any point you feel spiritual support would be beneficial whilst in hospital, please let the ward team or your key worker know, and they can liaise with the chaplaincy service. You'll be offered a referral to a team of specialist social workers who have experience of supporting families through the treatment journey. These social workers are based with a charity called Young Lives vs Cancer and aim to support families with the day-to-day challenges you may face. This can include employer and/or financial support, advice on benefits and grants you may be eligible for, and connecting you with other organisations that may be able to support you and your family. Our team of dietitians can help support your child's nutritional needs. If your child needs support to maintain their weight or gain extra calories, they'll be able to advise this and support you with a feeding plan. They can also liaise with teams of dietitians closer to your home to help in a community setting. Our team of physiotherapists and occupational therapists may be involved with your child depending upon their needs. You may hear occupational therapists referred to as OT. Some children do not require physiotherapy or OT during treatment. Some require a one-off, irregular review, and others may require a physiotherapy plan with regular reviews. This may be at GOSH whilst on inpatients or outpatients, or even in the community. Ways of physiotherapists may be able to help your child include developmental reviews, exercises to develop strength, balance or coordination, and for children who require equipment to assist with mobility issues, such as walking frames. Occupational therapists aim to help with day-to-day tasks, and they often work closely with the physiotherapists. For more information about support available to you during treatment, please refer to your family held record or contact your key worker who will be happy to help.